Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're raising awareness for Giant Cell Arteritis, or GCA, as we mark GCA Awareness Day. GCA is a serious autoimmune condition that causes inflammation of the blood vessels, particularly the large and medium arteries of the head. If left untreated, it can lead to severe complications, including irreversible vision loss, stroke, and even aortic aneurysms. Most patients are over the age of 50 when diagnosed, and early recognition is critical to preserving quality of life. To help us understand what it's like to live with GCA, we're joined today by Kathi Lopez from Texas, who was diagnosed in 2025 after a long and frustrating path to answers. Her story is one of resilience, persistence, and the challenges that so many patients face when navigating rare diseases. I also want to note that earlier this year on the podcast, we spoke with medical experts about GCA and the importance of awareness, early detection, and improved treatment options. Today, we continue that conversation, this time through the lens of a patient's lived experience. Kathi, thank you for being here and for sharing your story with our listeners.
Well, thank you for having me.
Can you start by telling us a little bit about yourself, what life was like before your health struggles began?
Well, we had retired and actually moved from Fredericksburg to the lovely Huntsville, Texas. And we were just kind of getting on with our lives and enjoying life. My husband had a few medical issues, so I feel like I was kind of a bit of a caregiver, and so everything was great. We're just retired and getting used to retired life, which is you're so used to being busy, going 24/7. It's like, what do I do with myself now?
So walk us through what first started happening in July 2024 with your shoulder pain. How did that eventually connect to your diagnosis?
Well, actually, it started kind of with one shoulder. I thought I'd hurt my shoulder weed eating. And so I iced it and thought, okay, that's fine. And weed eated the next week like I would normally do. Then kind of my biceps started hurting. This was in July. So I had read about bicep tendonitis. So I iced them for really 2 months. And finally, it started going away. And at the same time, I kind of felt like I started to have some headaches. And then in September, I had like an infection, a UTI. And then in October, I had some dental work done. And all this time, I'm kind of having headaches. I have this discomfort on laying in the back of my head. So I went to the dentist, and the day after, they told me I had a cracked tooth. And the next day, I started having this jaw pain, which just increased to where I could barely even open my mouth. I couldn't chew more than 10 bites. And finally, I went to the doctor with all these wacky symptoms, and it was just the nurse practitioner. And she said, okay, you have sinusitis, and that the jaw pain, that maybe I could see a physical therapist, or I said, I'll do anything because I was just in pain. She gave me steroid shot and CPAC. And then the next week, it was still there. And that week, my husband had Googled some of these wacky symptoms, the fact that it was the shoulders, it was the back of the head, it was the jaw pain. And he had come up with this giant cell arteritis, which sounded so weird, and said, you've got to come with me to the doctor because I feel like an idiot. And so we went in, and John explained it, said all my symptoms were still there even after a week. And he mentioned the giant cell arteritis situation. And she said, there's really just no way that you can have that. And so we said, okay. And so she had done blood work, the CRP, and that actually seemed high. I think it was 25 and it's supposed to be under 1. We mentioned that that was really high. And she said, oh, well, that's just kind of normal. She gave me more medication, and then I took the medication. And then a week later, we ended up in the emergency room, and they explained with the giant cell arteritis, you had to have a biopsy. And there were only certain doctors that were able to do the biopsy. And so they gave me the 60 milligrams per day of prednisone and sent me home. And until that point, I mean, I had read about the possibility of the loss of vision, but not only they say a lot of things about going blind, but you don't really take it so seriously. And then plus they said, note any changes in your vision, which I really didn't note any changes in my vision. after that, I did seem to feel a little better. Some of the symptoms were gone. Of course, I didn't realize at the time that, of course, taking the prednisone is probably what was reducing those symptoms. So I had an MRI scheduled, I had a neurologist scheduled, and then that following week, I went to go to the neurologist. They said that my insurance had not approved yet, so I didn't go. And then my husband was having some heart pain, and so we were going to have a procedure 2 hours away. So we stayed at a hotel, and at 5 that morning, I thought, gosh, I kind of feel funny. And anyway, I closed my one eye and everything was fine. I closed the other eye and I only had vision from halfway down. And I thought, ooh, this is not good. I called the eye clinic, and the next morning I went. They were gone for 20 minutes and came back and said it's textbook giant cell arteritis.
Yeah, no, that's thank you for sharing. And I think it's, to me, what stands out about that story is the work of your husband. We like to talk here at GHLF a lot about the importance of caregivers. And frankly, it is very difficult as a patient to navigate the health system without someone by your side, whether that is a spouse or a child or a close friend. The caregivers really are very important for folks dealing with what you were going through and a myriad of other diseases as well. So I think that really stood out for me. How did you finally connect with the rheumatologist and get on the right treatment path for your GCA?
Well, once again, I have to give it to my husband. He had identified that situation in which doctors we needed to go to. They really said a neurologist, and I think that he knew that eventually we were going to end up with a rheumatologist, but the information was a little bit confusing because of the fact that it was in the head. And, by then you could even see the veins in my temples protruding. So we thought, well, we'll just go to the neurologist first, who said, of course, I can't do anything for you. And then he sent me to the rheumatologist, which was a godsend. Any of these autoimmune situations, a rheumatologist is, because she was right on target.
What do you wish doctors had known or done differently earlier in your journey?
Well, I wish that they had listened more. And I want to say I wished I had been more aggressive, but I guess at the time I felt like I was being aggressive. It's funny because as a caretaker, which I kind of had been for my husband, well, and I mean, he was that way with me too, but I would have never stood for it if it had been anyone else. But when it's you, and this is something I'm kind of saying to all your listeners, when it's you, you think, oh, it's going to be okay, or I'm going to figure it out. You don't maybe take it as seriously, which is why the caretaker sometimes takes it more seriously than you do because you're in denial. And I guess the change would just be that they would listen more. And they would be more receptive. And especially when somebody comes in with what you think it is, then that would be a real red flag to educate yourself as a doctor to look into the diagnosis that person thinks that you might have. Because a lot of people come in and, oh, my leg hurts, and they're...
Well, let me just ask right there, if you were to offer any advice for folks having the same symptoms that you were describing, what advice would you give to these folks?
I guess if they were having the symptoms and they felt like all those symptoms were in line with what they had, then to ask the doctor immediately for a referral to a rheumatologist.
That's great, because that's very specific advice. Obviously, the general stuff you spoke about, bringing in a caregiver, coming armed with as much research as you can come with, have your questions ready. But like you said,
have your questions ready.
And the thing we always talk about here at GHLF is we talk about advocacy, and we always say advocacy begins with you as the patient yourself, and you need to be an advocate when you go in to see your medical provider. So everything you just said is so on point. You have to be the advocate, and if you're lucky and have a caregiver being your advocate as well, that's certainly helpful. How has GCA changed your outlook on life, and what message would you like to share with policymakers and providers about supporting patients like you, Kathi?
It changed my life because, of course, it humbles you. Up until this happened, I literally felt guilty for being healthy. Like all our friends around us, everybody's got something. You got high this, you got high that, you got this problem, that problem. I had no problems. So I kind of felt guilty. Well, I mean, the good thing is I don't have to feel guilty anymore. That part's good. But I think that as far as insurance companies, we did get the referral to the rheumatologist, and all these things do take time, but that unfortunately at every moment, you have to talk not only to the doctor's office, but you have to talk to your insurance company, because there's so many things that, in other words, you just have to be this little advocate about putting the two together. They say the doctor didn't send this over. Well, a lot of times the insurance company doesn't have what they need to approve something because the doctor has been remiss to send the information that's needed to get you the referral. In other words, getting that referral to a rheumatologist, act like that's easy. Well, that's not easy because
Right. You got to be the advocate.
Well, your primary care doctor has to prove to the insurance company that you need that referral. And so that would be the symptoms. And they do have overrides at these insurance companies where you can talk to the next level person up, which kind of set me 3 weeks back from the GCA diagnosis.
Thank you so much, Kathi. That was fantastic.
Thank you for having me. And I wish everybody the best of health.
Well, Kathi, thank you so much for bravely sharing your story with us. Your journey underscores the importance of awareness, timely diagnosis, and again, patient advocacy, particularly in rare diseases like GCA. And to our listeners, October 23rd is GCA Awareness Day. We encourage you to learn more, share resources, and help spread the word. No one should lose their sight or their peace of mind because of delayed recognition of this disease. For more information and resources, visit ghlf.org/GCA. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about health policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.